As Nigeria counts down to being officially Ebola-free, the people of Sierra Leone prepare for new measures to confront the Ebola outbreak in their country. The country's Ministry of Health has a 3-day plan that it hoped would help drive home the Ebola prevention message.
They'll be going from house to house, basically, to be able to provide a very clear message about Ebola and to be able to tell people what they should do within their family circles if they find that a particular member within the family is suffering from Ebola. We've been able to mobilize about 28,544 people into about 7,136 teams. And these people will visit the houses in Sierra Leone, about 1.5 million houses, between the 19th of September to the 21st of September.
With this announcement, the people prepare for the stay-at-home advice, stocking up on household needs.
I've come to buy medication, food stuff, and all necessary things, even water at home, so that will not go through me and my family will not go through these constraints. Because within the 3 days, you will not have the opportunity to go out and do your shopping.
It is better to stay at home for 3 days, even 21 days, than to lose thousands of people in a single day.
Moving on to Liberia, the country's president, Ellen Johnson Sirleaf, is hoping that U.S. President Barack Obama's decision to send 3,000 troops to West Africa to battle the Ebola outbreak would spur other countries to help.
We remain in touch with leaders of other governments and with the United Nations leadership to take similar steps and join us in partnership to end this disease. Ebola will not defeat us. Never. We have faced great tragedies before. These have tested us and shown our true character. I call on you to stand up again.
Johnson Sirleaf said her government was fighting back against the deadly virus, which has claimed the lives of some 1,300 people in Liberia. On Tuesday, President Obama called the outbreak a looming threat to international security and said the United States will be increasing its efforts to help stop the spread of the disease. The U.S. plan includes establishing a regional command and control center in Liberia's capital, building 17 treatment centers with 100 beds each, and training thousands of healthcare workers. The World Health Organization said at least 2,622 people have died out of at least 5,335 people infected in West Africa. It added that a surge in Ebola in Liberia is being driven primarily by a continued increase in the number of cases reported in the capital, Monrovia. Finally, Medecins Sans Frontières has revealed that a French volunteer working for the medical charity in Monrovia, Liberia, had contracted the Ebola virus. The volunteer, whose name is currently being withheld for purposes of medical confidentiality, is the first French national to contract the deadly virus. She was immediately placed in quarantine when the first symptoms of the illness appeared.
She will go to a hospital which is specialized in this type of treatments, and then it will depend on her clinical status and the evolution of the pathology, how she will be treated. And afterwards it's a decision of the treating doctors and the patient, the person affected, whether or what treatment will be chosen.
Meanwhile, senior MSF officials say the international community needs to unite to efficiently evacuate workers infected with Ebola. The French medical charity have previously complained about the slow international response to the epidemic. The charity's leaders have been calling for a coordinated evacuation plan for several months, including a dedicated evacuation plane on standby in the region to transport infected medical workers back home for treatment.